evening and thanks for joining us. It is now official. Canada has its first confirmed case of the new strain of coronavirus.
Health officials in British Columbia said earlier there is a presumptive case of the illness in that province. That means there's now one confirmed case in Canada, that one's in Toronto, and two presumptive cases, also in Toronto and now in BC.
2020 was not a normal year because of the COVID-19 pandemic. People say that a lot, but what is your normal? What is my normal? For Black people, many times, a normal day is a dream, an aspiration that is hard to live. A normal year, we have to fight for that, or pretend to have that, or ignore a lot to have that, or simply not expect to have that, in order not to be disappointed. So to know what a normal year is may not be a given, not to talk of hoping for it. Well, except when the normal we're talking about is structural racism and discrimination. So there's that normal, where the norm is to remind others that Black lives matter, a normal that a not normal year like 2020 only worsens. What am I saying? 2020 was also the year of George Floyd. George could not have a normal day as some others. On the fateful May 25th, 2020, George could not be free, be respected, be loved. He could not have a day with no major surprises. But George had the other type of normal day, the kind in which one's skin color matters. His mattered for all the wrong reasons, and it was not surprising. Let's just say, before the COVID-19 pandemic, Black people, Indigenous people, and other people of color were all facing endemic racism and structural oppression. In this sense, the early echoes of COVID-19 only meant more strife for Black people. Where the trajectories of the endemic and the pandemic met was never going to be a place for us to breathe. At a time that the COVID-19 virus had infected more than 1,320 people and killed at least 41 in China, Canada's health authorities were optimistic that COVID-19 posed a low risk to the people of Canada.
That is the primary message that I want to give Canadians. The risk of contracting coronavirus is low.
With the benefit of hindsight, the health minister's assurance did not age well. But why was this the assessment? Maybe Canada did not yet understand how infectious the virus was. Maybe Canada underestimated how interconnected the world is now. Or maybe Canada simply trusted its ability to stop a virus from crossing into the country. The risk was not low as claimed. It took just a couple of months to know and feel that. The rapid increases in COVID-19 cases in a very short time told the story of how contagious and communicable the SARS-CoV-2 virus is. It also told the story of the overwhelming challenge Canadian society, like most others around the world, faced. But a deeper look at the numbers told another important story: the disparity in infection rates across racial and ethnic groups in Canada. Dr. Howard Njo, the Deputy Chief Public Health Officer at the Public Health Agency of Canada, draws our attention to this phenomenon.
A recent Statistics Canada report found that Black people living with low income had COVID-19 mortality rates that were 3.5 times higher than non-racialized people.
This graphic by Statistics Canada indicates that in the first year of COVID-19 in Canada, Black males were 3 times more likely to die from the virus than non-racialized males. In the case of Black females, they are about 2.5 times more likely compared to females in the non-racialized population. When Statistics Canada factored in income levels for the same one-year period, they found that Black persons in low-income brackets were over 3 times more likely to die from COVID-19 than non-racialized persons. Even for Black persons not in the low-income bracket, they were still twice more likely to die from COVID-19 compared to those in the non-racialized population. Why this disparity? We asked two experts. The first is public health researcher Dr. Prince Edu of the BC Centre for Disease Control and the University of British Columbia.
This is not because our population is sort of biologically inherently susceptible to the virus.
The second expert is Dr. Jifa Dodunu, a nursing professor at the University of Victoria. Jifa is also a community leader.
The matter is SARS-CoV-2 is not a racist virus. This virus is capable of affecting Black people as much as white people and everybody in between.
Most importantly, or really the reason is because of what we call the social determinants of health. So those conditions that make it more likely for one to catch the virus.
But because of the social positioning that many people, including Black people, live in this constant state of not having enough, they are more likely to be exposed to the virus and therefore more likely to get sick.
They both talk about the social conditions, but what are these?
I'm looking at things like, say, poor housing, underlying medical conditions. I think that's the major one. And then even certain occupations that make it more likely for you to say interact with people or find yourself in closed spaces. These drive infection rates.
So yes, this was a global pandemic and a national crisis, but structurally marginalized groups would have it worse in terms of infection, hospitalization, and mortality rates. Black communities were worse off. I will go back to the beginning and ask again, what is your normal? What is my normal? Canada's federal government, provinces, and health authorities put in a lot to limit the spread of the COVID-19 pandemic. Cue the emergency measures.
COVID-19 constitutes a danger of major proportions.
Decisive action is needed, and we are taking that action.
This declaration of an emergency enables me to be faster, more streamlined, and nimble.
There was the mask mandate, social distancing mandate, quarantine mandates. There were the almighty lockdowns. There were travel restrictions too.
We will be denying entry to Canada to people who are not Canadian citizens or permanent residents. Anyone who has symptoms will not be able to come to Canada. Only 4 Canadian airports will be accepting international flights.
With restrictions on public gatherings, entertainment centers closed, recreational centers closed, schools closed or going virtual, remote work being the order of the day, people stuck in places they did not have to be. Life had changed. Nothing was normal. Who can forget about the vaccine mandates? Quickly, vaccines became a key tool for fighting the SARS-CoV-2 pandemic. Why?
Vaccines are one of the most effective tools that we have to protect people in Canada against severe illness and death from COVID-19.
Dr. Ralph Pantoffle, a professor at the Simon Fraser University, who also heads the university's Laboratory of Infectious Diseases Immunology, has this to say on the value of vaccination. Vaccination is one of the cornerstones of public health. Vaccines help to limit the spread of infectious diseases, not just old adversaries, but also emerging threats. With the vaccines came the passports and the QR codes that were meant as a way of gradually opening up the economy.
This is our way of getting through this next phase of the pandemic that we've been dealt, and to make sure that we can go through the fall with safely reopening schools.
British Columbians need to know that this is the first time anything like this has ever been tried. There may be bumps along the way, but we're very confident.
Despite the publicized health value of vaccination and the value of vaccination cards to socioeconomic participation, there was some hesitancy to the COVID-19 vaccine. Early research found that vaccine hesitancy was high amongst Canada's Black population.
Some people and communities, including those disproportionately impacted by COVID-19, are less likely or able to keep their vaccinations up to date. This includes people living with low income and racialized communities.
Results from the Canadian Community Health Survey for the period of September 1st to December 12, 2020 showed that 76.9% of Canadians, excluding residents of the territories, aged 12 and older reported being somewhat or very willing to receive the COVID-19 vaccine. However, only 56.4% of Canada's Black population aged 12 and older reported being somewhat or very willing to receive the COVID-19 vaccine, a difference of 20%. As Dr. Njo points out, in some cases, the low uptake of vaccination may be less about hesitancy.
There are many reasons for these health inequities, including not having vaccination services available where and when needed.
But why was there such initial vaccine hesitancy within Canada's Black population? Cheryl Prescott, Executive Director, Black Creek Community Health Center, said this in an interview with CBC.
When we talk about vaccines, again, there's that mistrust. Something will now be injected into your body. Can we trust that substance? Can we trust what's happening? We know that, studies were done in the Black community, for example, by public health agencies in Tuskegee, for example, where Black men were engaged in the syphilis study. And that's something that folks know, and I think builds the mistrust.
As Cheryl notes, the mistrust is not baseless, it has long roots. She mentions the infamous Tuskegee experiment, for example. The Tuskegee experiment was conducted on over 600 Black men in the USA from 1932 to 1972. While the actual goal was to observe the natural history of untreated syphilis in Black populations, the subjects were completely unaware. They were instead lied to that they were being treated for bad blood, but they never received any treatment at all. These men were just used as guinea pigs without their knowledge. Also, in 1996, 11 children died in a clinical trial led by Pfizer when the northern state of Canada was hit by a meningitis epidemic. There were claims that Pfizer did not get parental consent to use an experimental oral antibiotic on the children. There were also concerns about how well the study was documented. In 2011, Pfizer paid out compensation to the Nigerian families affected by the study. Do you see why some Black people have been hesitant about the COVID-19 vaccine? Their normal is not your normal.
Experiences that have resulted from the century-old notion of race as biology instead of the socially constructed system of oppression and privilege has led some of us to become mistrusting of the health system and even in some cases the belief of superiority.
There is also the misinformation and disinformation challenge. Dr. Upton Allen, a professor of pediatrics and the head of the infectious diseases unit at the Hospital for Sick Kids in Toronto, spoke about this challenge in an interview with the CBC.
Just people getting wrong information or data that drive their decision.
When the Hogan's Alley Society researched vaccine hesitancy amongst Black people in Vancouver, they also found that
of those who were unlikely to get a COVID-19 vaccine in future, many were worried about the side effects of the vaccine. The study generated responses from 317 self-identified members of the Black community in BC.
In community conversations and a survey led by the African Art and Cultural Community Contributor Society, also known as the Isamba Center, some Black respondents pointed to other concerns such as how quickly the vaccines were developed, as well as how the need for multiple brands and doses could suggest experimentation. In response to the concern about different vaccine brands, Dr. Ralph Pantoflet has this to say. All vaccines have undergone the highest level of clinical testing to protect against severe disease and often hospitalization. The development of different vaccines relates to the rapid global spread of SARS-CoV-2 in 2020, which spurred an urgency to protect public health through vaccination. Most vaccines, not just those against COVID, require at least 2 injections to achieve an adequate level of immune protection against disease. The level of protection offered by most vaccines declines over time. This is a natural occurrence. Booster vaccine shots are used to bolster our immune system. Seasonal influenza vaccines, for example, help to boost our immune system so that it is able to limit disease caused by seasonal flu variants. Until Omicron, vaccines based on the original SARS-CoV-2 strain were sufficient to boost immunity levels against early variants of concern, alpha, beta, gamma, delta, etc. Omicron and its subvariants are, however, so different from the original strain that vaccines have now had to be modified. Hence the introduction of bivalent vaccines. As we cannot predict how the virus will evolve further, it is impossible to predict whether and when future SARS-CoV-2 vaccines might need to be modified again. Over time, the uptake of COVID-19 vaccination has massively improved across Canada. 83% of the population has received at least 1 vaccine dose. This trend is similar amongst the Black population, as Hogan's Alley Society found in their own study.
85% reported they had already received the second dose or were likely to receive another dose. This was possible because the survey ran from October to March 2022 after the vaccine passport system was introduced in the province. We reported significant associations between the intention to receive an additional COVID-19 vaccine and positive attitudes towards COVID-19 vaccines. The study also showed that the decision to receive an additional dose in the Black community was strongly influenced by family doctors, provincial health officer, co-workers, and educational institutions.
Brianna Taylor, who started and runs the Black Motherhood Collective page on Instagram, suggests an approach to alleviating the trust deficit.
Repairing the relationship and making sure that there is a level of trust between the Black community and healthcare professionals so that we can have confidence moving forward.
It's important to ensure that the messaging relating to vaccine prioritization is appropriate and is very transparent and very clear so that there's no misinterpretation of intent. In other words, there's no perception that they're being used as guinea pigs.
Community truly lies at the very heart of Canada's pandemic response. The Immunization Partnership Fund aims to improve vaccine confidence, access, and uptake through initiatives led by communities for communities. The program is run by the Public Health Agency of Canada and funds organizations at the local, regional, and national levels. To date, over 100 projects have been funded to help break down barriers and counter vaccine misinformation through evidence-based, accessible, and culturally relevant activities.
I think it's time to take a breather. Pause and soak in everything in silence. Revisiting the beginning and thinking about the question, is your normal my normal? If you have not been through what we have been through, our doubts and hesitation may sound funny, unscientific, and baseless. Hear me, hear us, acknowledge. COVID-19 vaccines have been helpful, but there are problems vaccines cannot solve. The disproportionate impact of the pandemic has not only been in terms of infection rates, but also socioeconomic, mental health, and other implications. According to Statistics Canada, visible minorities are also more likely to work in industries worst affected by the pandemic, such as food and accommodation services, compounding health and economic risks. Visible minorities, already economically vulnerable, also face greater financial impact. Immigrants and visible minorities are more likely to report facing harassment, attacks, and stigma. According to a BCCDC survey, A greater proportion of respondents who identified as Black or South Asian reported difficulty accessing their family doctor, 80% and 85% respectively, and diagnostic services, 38% and 35% respectively. The percentage of Black respondents who said their mental health had worsened over the course of the pandemic, 60.3%, was about 3% higher than non-Black respondents. Nearly 1 in 3 Black respondents said their job situation worsened over the pandemic, compared to 1 in 5 non-Black respondents. More than 1 in 10 said the same about their housing situation, compared to 1 in 20 non-Black respondents. Our normal has been bad and it was worsened by the pandemic. Indeed, there are simply things that vaccines cannot cure. Thankfully, a number of Black-led and Black-serving organizations stepped up at the height of the pandemic to support members of the communities because Black lives matter. They provided food baskets, cash donations, virtual conversations, and shelter. Some provided key support to seniors, including care, grocery shopping, and simply being available for conversations. Trisha K. Williams, a clinical counselor and the CEO of Metamorphose Counseling, was one of the community leaders who gave back.
During the COVID-19 pandemic, there are 3 ways that I provided free counseling to individuals that needed counseling. So the first one had to do with responding to individuals that were overwhelmed by the COVID-19 pandemic, but also by the death of George Floyd in 2020. Metamorphose Counseling provided access to free sessions for continuity of care for clients that we already had. A second thing that we did was we created a YouTube channel called Meta Transitions, where we shared free counseling resources to select individuals who, wanted information about counseling, but didn't necessarily want to sit in a counseling seat. But it also helped to reduce the stigma of people seeking help who, maybe wanted to try counseling, but wasn't sure what it was all about. The last thing I wanted to indicate that we did was being contracted by the Vancouver Black Therapy Fund and Simon Fraser University, where we, provided counseling to Black identified persons. This was important to me because the access to therapy would be free for the clients who needed it. I also joined the directory Healing in Color, where I opted to provide 3 free counseling sessions to refugees who are new to Canada.
The Isamba Centre in Victoria, BC also provided free food baskets to community members. Zinhle Dewa, a former undergraduate student at the University of Victoria, has this to say about the pandemic and Isamba's support.
Starting during, I think, Black History Month in 2021 or maybe even 2020, Isamba was giving out hampers with very culturally relevant foods, spices, and we could even choose what we wanted in our package via email. That was such a blessing to my life. At the time I was not employed, and so it just really was everything I needed, and I'm so grateful for Isamba. So thank you to everyone who participated in that. And it can be tough to go through a pandemic while separated from family and not able to meet up with friends, and so mental health was a very important thing. Having community helped my mental health. Having people who were also going through what I was going through, and having smiling faces whenever I would see, people at Isamba was such a blessing. So I just want to say thank you so much for the support.
In the poem Glass Hands, L. Jones writes, "We can relearn how to care for each other. We can relearn how to share with each other. Let us honor the dead by committing to the living. Let us honor the dead by committing to giving. We're not broken, though we are diminished. We still have time, and this is not the finish. There is faith and hope, and it's within us." I only came to say, your normal is not my normal. If 2020 and 2021 were not normal years, my abnormal was not your abnormal. Listen and you will hear. Ask and you will understand.